We're going to provide a quick update on our efforts around vaccine equity, including right here in Revere. But first, I want to give a quick update on the state of COVID. First of all, the Department of Public Health reported 1,566 new cases, COVID cases, on about 61,000 molecular tests. We've now done about 19 million, over 19 million tests here in the Commonwealth. 725 patients are in the hospital for COVID and 169 are in the ICU. With respect to vaccines, we crossed over 2 significant milestones yesterday. First of all, we've now delivered and administered over 4 million total doses to people across the Commonwealth, and more than 1.5 million people are now fully vaccinated. We continue to be a national leader in getting people vaccinated. We're the top state for both first doses and total doses administered among the 24 states that have more than 5 million people. Our progress has been especially notable among those most vulnerable to the virus. Over 82% of Massachusetts residents over the age of 75 have received a first dose, which is significantly higher than the national average, and that helps us keep cases and hospitalizations down among this particular group, which, as we all know, has been terribly negatively affected by COVID. And our vaccination rates among Black and Hispanic residents are about double the national averages, although places like this are part of how we continue to build on the work we've done on that front as we move forward. On Monday, we expanded vaccine eligibility to include everybody over the age of 55 and people with at least one medical condition from the CDC's updated comorbidity list, making another approximately 1 million people eligible to get a vaccine. I'm happy to report that I feel good. I got my first shot yesterday, and I had all kinds of text messages last night and this morning about how I was feeling. It's nice to know that so many people care. That was a joke. Thank you for laughing. And I, you know, so far so good. But as I said yesterday, it does feel like a shot. As more people become eligible, we hope to see continued increase in the supply that we receive from the federal government, because we have tons of capacity we can put to work to make sure that whatever we get through the federal supply process, we'll be able to get into people's arms very quickly. The pre-registration system we launched a few weeks ago is working well. So far, around 1.5 million people have pre-registered, with over 800,000 having been contacted with the opportunity to book appointments. When it was launched, the pre-registration system included all 7 mass vaccination sites, and this week we're adding 2 regional collaboratives to the system as well. Later this week, the Amherst Northampton Collaborative and the Marshfield Regional Collaborative will be on our pre-registration system, and appointments will be offered there for folks as well. We plan to keep adding more regional collaboratives during the month of April as we move forward. And also by next week, the user experience will change for people who are contacted with the opportunity to book appointments. People will have the opportunity to select their vaccination location before proceeding to select from available appointments. And we'll continue to make improvements to the system in the weeks ahead, and to make the process even easier, especially as we move toward the April 19th date on which everybody will be eligible to pre-register. Today we're here in Revere to spotlight the vaccine clinic here at Wonderland, right off the Blue Line. It's the second time in the past week we've gotten a chance to join Manny and the team from East Boston to talk about their work and to tour one of their sites. That speaks to the work that you and your team are doing for us in some of our most disproportionately impacted communities. We really appreciate it. Revere is one of the 20 most heavily prioritized communities under our state's equity initiative. These communities were identified based on the disproportionate impact of COVID and key metrics around social determinants of health by the Department of Public Health. And we work with these communities, including Revere, in a variety of ways. We continue to supply their local health departments with new first doses. In Revere, these doses are being used to support homebound vaccinations and other hard-to-reach populations. And in partnership with Archipelago and Healthcare for All, the grassroots campaign has been launched to promote vaccine access and awareness, which includes, among other things, door knocking and canvassing, and community events, which are starting this week. And in Revere, this will include 37 bilingual organizers working on the ground. Each community has a designated community liaison from the Department of Public Health to work with the local board to help support the vaccine rollout and to do whatever we need to do to help the folks locally both message and make vaccines available to folks. Earlier this year, we announced targeted investments in community and faith-based organizations doing vaccine outreach in these communities, and organizations doing this in Revere received over $120,000 in grants. Last week, we also announced about $55 million in grants provided directly to these communities to support local public health infrastructure as we move forward, and more funds for these communities as part of the $30 million equity initiative will be forthcoming. Revere is being prioritized for mobile vaccination clinics as part of our partnership with FEMA. This enables us to leverage some of the 6,000 additional doses that we receive every day through the FEMA partnership for hard-hit nearby communities, and these pop-up clinics will be set up in easy-to-access locations based on what works best in each community. There are grassroots teams that will work with community members to help people book appointments at those sites, and these are in addition to the mobile clinics that the city is coordinating here in Revere already. In a minute, the mayor will probably talk a little more about the work that the city's doing to get their residents vaccinated in partnership with the Commonwealth and many other organizations here in the city. We're grateful for the chance to work with committed local leaders like Mayor Arrigo in these prioritized communities. Together, they're helping residents in these communities get access to vaccines and work hard to recover from the pandemic. The vaccine is obviously a crucial part of how we get past the pandemic and help our communities recover and move forward. Getting the vaccine is the best way people can protect themselves, their families, their neighbors, and their communities. The vaccine is safe. It's been through all the same tests and clinical protocols as other vaccines. It's effective against the variants and at preventing people from getting sick or dying from COVID. That's why we're working so hard in collaboration with our partners in local government and many community-based organizations and faith-based organizations to get more shots in arms every single day. I can't emphasize how important it is for people to sign up when they're eligible and to get vaccinated when it's their turn. It is in some respects one of the most important things we can all do to get back to what we might describe as the normal we used to know before the pandemic.